Hi, everyone. For this week's discussion, I'll be reviewing the pathophysiology of cellulitis. Cellulitis is a common skin infection that occurs when bacteria penetrates the skin barrier. Penetration of the skin barrier can be a result of trauma, edema, impaired venous sufficiency, impaired lymphatic drainage, or inflammation. Once the bacteria is introduced to the skin, the immune response begins. First, blood flow to the area is increased. Next, a fluid and protein shift from the extracellular space toward the interstitial space results in edema. Then the shift of these extracellular fluids and proteins results in increased pressure on the nerves, which as a result causes pain. As cellulitis is a common infection, the risk factors are plentiful. The major risk factors include trauma, such as lacerations, abrasions, and pressure injuries, IV drug use, insect bites, skin conditions such as psoriasis and eczema, long use of immunosuppression medications, diabetes, obesity, HIV, and peripheral vascular disease, but the list goes on. As we touched upon in the pathophysiology portion of this flashcard, the telltale signs of cellulitis are edema, erythema, warmness at the area of infection, pain at the area of infection, and expansion of these symptoms as the infection spreads. If the infection is severe and the tissue reaches elastic capacity, the patient may experience loss of function to an affected extremity. The clinical signs and symptoms we see are due to the body's inflammatory and immune response. As you can see in this photo, the right leg is much more swollen than the left leg. There's some blistering down by the ankle, and the whole extremity is angry red. An important clinical practice here would be to outline the reddened area to mark for any expansion. And lastly, we discussed the diagnosis. Diagnosis of cellulitis is based largely off of clinical presentation. Laboratory testing is not necessary and will not change any of the treatment, but patients may be found to have a slight leukocytosis. I hope this presentation was helpful. Thanks for listening.